Hi, I'm Gene Liu and I'm an otolaryngologist, head and neck surgeon, or ear, nose, and throat doctor here in Los Angeles, and wanted to talk about adenoidectomy and the recovery. So you or your child just had their adenoids out. First off, there's going to be some discomfort, but usually it's not too bad. Generally recommend taking Tylenol or Motrin. You can alternate them if you need to. Most people end up taking pain medications for 4 or 5 days. Because the adenoids are in the middle of the head, the discomfort that you feel could be anywhere from the ears to the throat to the top of the head. Even adults have a hard time describing where the discomfort is. Even though we take out the adenoids, there's some immediate swelling of the area, so any stuffiness, nasal congestion, or snoring probably won't go away until the healing is done. It's going to feel like a head cold. You're not actually sick or contagious, you can be around other people, but you're going to be a little bit stuffy, run down, and tired. For a week to a week and a half after surgery, you recommend not getting into an airplane because a stuffy nose with altitude changes can be very uncomfortable. We also recommend not going swimming because you can accidentally snort water into your nose and cause discomfort. Once the area is completely healed in that 7 to 10 days after surgery, you can basically go back to all normal activities. Having a temperature that creeps up to 101 or even higher sometimes after tonsil or adenoid surgery is completely normal. As long as it comes back down with Tylenol and Motrin, we're not going to worry. Keep in mind though that if your temperature is creeping up, it's even more important to hydrate. It's only if the temperature stays above 102, even though you're taking Tylenol and Motrin, that it's time to call the doctor. Another thing that people really notice in the recovery period is a horrifically bad breath. When you lean in for a smoochy little kiss from your child, you're going to notice it. Sometimes it's bad enough where you even open the bedroom door and you catch a huge waft. That is completely normal and will go away once the healing is done. Don't try to get rid of the bad breath with toothbrush, mouthwash, or anything. It will go away when it's done healing. Something else that we notice is neck stiffness. The area behind the nose and throat gets stretched when you're moving your neck around. So in the recovery period, there can be a tendency to not want to move the neck. That goes away once the healing is done. The adenoids were removed from an area behind the nose. Normally food and drink don't get to the area. That's the place where if you drink something and laugh and it squirts around the back, that's where the adenoids are. But almost always when you're swallowing, things go down and not up, so you don't really have to modify the diet much. Things that will stimulate the area are things like wasabi or anything that makes your nose tingle, something spicy. Also something warm or super hot in temperature, the heat can rise. Or carbonated beverage where the bubbly fizzy stuff will go up. Those are things that most often children aren't having anyway. Almost always from taking out the adenoids there's going to be a change in voice, but it's taking somebody with a more nasally congested voice and opening it up. That's completely normal and expected. In very rare situations, because the area is a little bit sore and the muscles in the back of the throat don't move as much, if you drink sometimes water can squirt around the back, or when you talk air can kind of leak through and may sound a little bit like this. That's completely normal, it's rare, but if it happens it almost always goes away in a few weeks. In general, if the only procedure that you had was an adenoidectomy, no follow-up or post-op appointment is necessary. There are no stitches to take out, and the only way to look at the area is with a little camera in the back of the nose. And if your child is doing well, we're never going to subject him to that. Even though there's no follow-up appointment scheduled as a routine, we'll always be happy to see you if you have any active concerns. I hope this information was helpful. If you have any other questions, feel free to reach out to the office.